to join the first debate of the first budget presented by this Progressive Democratic Patriots administration. I would like to start by congratulating my dear colleague, the Chief Secretary, and Secretary for Finance, Trade and the Economy for a stellar budget presentation. I understand that there are people in Trinidad who are still speaking in amazement at how forward-thinking and how visionary and how, for the people and how refreshing, yes, that budget was that you presented on Thursday. Congratulations. Madam Presiding Officer, I am deciding as I stand which direction I should go, because I had come prepared to speak about what is happening at the Division of Health, Wellness and Social Protection and, of course, the Tobago Regional Health Authority. But after listening to the minority leader, I am a teeny-weeny bit confused. Yeah, just a teeny-weeny bit. I am trying to figure out, Madam Presiding Officer, if we know, if all of us in this room knows that the PDP has been in office since December. And I am also trying to figure out if, and yes, I know you keep saying it because you want to prevent us from saying it. But my dear ex-principal came into power in 2001?
Yes, that's correct.
2001. 2001. 4 consecutive terms.
Excellent.
And
we still yes.
You're the organization that is represented by the minority leader was in control of this Tobago House of Assembly up until December. Exactly. So I am wondering, Madam Presiding Officer, if he recognizes that everything...
Minority leader, please.
Thank you.
Pay the same courtesy. Please. Thank you.
Thank you.
I am wondering, my dear friend, if you recognize that when we speak about our young people not doing well in school and the poor tourist numbers and not mapping the tourist attractions and all of that stuff, that you laid out, that sounds so nice and sounds so simple and sounds so easy to do. Do you realize that up to December, the organization that you sit here proudly representing that you campaigned for, had the opportunity to do every single one of those things that you just spent time talking about? Maybe it is because, and I am really happy that the minority leader has indicated that, yes, some of the things that we spoke about, or that the Chief Secretary spoke about on Thursdays, are things that have been written in plans and manifestos, but the reason we need to speak about them now, and the reason we need to talk about them now, and the reason we need to put them in 2023 is because they were never done. Promises never materialize. The organization that you represent, and I will say it again, promises never materialize. I look back at some of the budgets over the last couple of years because we're talking about a 3.97 billion budget being lofty. But I look back at the budget that was read in June 2016, 5.39 billion. June 2017, billion, 4.91 billion. 2018, 4.58 billion. 2019, 4.71 billion. The budget that was presented last week is what? 3.7. So when we talk about 3.97, so when we talk about, Madam Presiding Officer, the need for us to temper ourselves on this side, what I recognize is a continual wish of the Promises Never Materialize organization to say to the people of Tobago that you all need to keep accepting their absolute bare minimum. Absolute bare minimum is what you are telling the people of Tobago. Because we have recognized that what you have been saying is the people on this side who have asked for 3.97 billion, and we have asked for 6.9%, which, by the way, and I'm going to say it again because it seems like we continue to forget it, the Dispute Resolution Commission, just before Mr. Charles demitted office in 2000, indicated that we can get from the central government between 4.03 and 6.9%, which means right now, without any new laws, we are able to get 6.9%. Madam Presiding Officer, I understand that what I am saying is very, very, very disturbing, which is why you can continue to try to disturb me and to try to derail this.
This is the last time I'm going to be saying this. Please allow for members who are making their presentations to have their presentations be made without any interruptions. Please, everyone. Continue.
Thank you again, Madam Presiding Officer. We can get, and I will say it again, at this point, if we look at all of the estimates, all of the $3.97 billion, because it really does represent the 6.9% of what we estimate the national budget to be. Because in 2000, there was a ruling that said we can get up to 6.9%. So we will say to those on the other side that if whole last year you were telling us that you were willing to give us 6.8%, whole last year, started in January with the consultations, the whole last year, you were telling us that we could get 6.8%. Remind your colleagues of that promise that they made to the people of Tobago. I want to touch on one other little thing before I move into my substantive presentation. And it is the fact that one of the things we recognize having come in is that we have so much debt. So much debt to the point that I am now personally, as Secretary with responsibility for health, wellness, and social protection, afraid to go into meetings with entities. And let me give you an example. In February or maybe March, Madam Presiding Officer, we'd been getting these bills from an organization in Trinidad. And the bills that came to my desk from that organization in Trinidad says that we owe for January about 18,000. We owe for February about 20,000. You know, we owe for March about 20,000. And then, Madam Presiding Officer, I take my fuck itself because I didn't really understand why we were being billed these bills. Check my fuck itself and called a meeting with the organization. Because, you know, when you're talking about those kinds of funds, that's not a lot of money to cover. So I said, you know, we could figure it out. We could figure out how we pay the 20 and the 18. Only to be told, Madam Presiding Officer, by that organization that it's not just for January, February, and March that you have not paid, but you have never paid a bill. And when the rooms, the rainbow rooms, started in what, 2017, 2018, around there, when we started providing the services for the rainbow rooms about 2017, 2018, around that time, we have not paid a single bill from since then. So I foolishly walked into a meeting thinking that we need to figure out how we're paying $20, $40, probably $60,000, only to be told that is about $200 and something thousand that we have to pay because we have never paid a bill. And you, on the minority side, have the gall, have the unmitigated gall to talk to us about being responsible and paying the people who we owe. Who we owe, honestly. Who we owe. Who do we, in the Progressive Democratic Patriots, who, Madam Presiding Officer, do we owe? But what we will do, Madam Presiding Officer, is that we have come in recognizing that the people of Tobago have given us the mandate to fix this, even all of that mess. And that we will take our time, and that we will strategically do. One more little thing. We are speaking about the fact that the Promises Never Materialize organization is now under new leadership. Is now different. But I am wondering if the minority leader recognizes that the person who sat in the chair of Chief Sec is now the leader. So if you had an opportunity to do it right, you could have started since January last year, when the seat was hijacked. So I do not know who in Tobago will believe that this organization is brand new, suddenly brand new, because you are now sitting there. Madam Presiding Officer, one of the things that I figured out on the 13th or maybe the 14th or the 15th of December when I walked into the Division of Health, Wellness and Social Protection was the fact that I was walking into an organization that in essence needed to be rebuilt. Rebuilt in essence from the ground up. And that is what we have been doing. And that is what we will continue to do for fiscal 2023. So we have been working very closely with Management Services Unit to ensure that we build out this organization. One that can actually provide effective and efficient service to the people of Tobago. Let me just say one little quick thing while I am here. One of the things that was said to me, and I couldn't even believe it, Madam Presiding Officer, is that the first couple days having walked into my office, the first couple days having said to some of the individuals who were my colleagues many years ago while I worked at the Division of Health, because they are the heads of departments and they are, in senior positions in the organization. And I said something that I thought was simple. Come and see me in my office now. And it is at that point, many of them come up and say, wait, is so up your look? Is so up your look? And I said, what do you mean by set up your look? This is the Secretary's office, and they let me know that they had never been allowed up there before. And they let me know that they were not allowed to ride the elevator with them. So when I say, Madam Presiding Officer, that we are in the position right now of building an organization, I don't just mean building the actual structures, as in the positions. No, that's not what we're talking about, Madam Presiding Officer. We are actually doing mental health building of the officers who have been there and who have been abused and who have been misused and who have been afraid to say things because of the level costs that some of them were getting. So, Madam Presiding Officer, within the next fiscal, you would see within the Division of Health, Wellness and Social Services a Department of Health. And that Department of Health will be an entity that actually does something that we've never been able to do in the Tobago House of Assembly before. That includes actually doing an overview of the Tobago Regional Health Authority. See, what we've been doing for all of these years is just saying to the Tobago Regional Health Authority, we are giving you this money to do whatever. We have never really been in a position where we had the people at the divisional phase to say, this is the data that we've collected about health. Because we've collected this data, this is a policy we can now build. Because we've now built this policy, this is the annual services agreement that we are now going to give to you. And now that we've given you the annual services agreement and we've given you the money, we can then say at the back end that we are now monitoring and evaluating what you do to see if the money that you are spending has met the requirements. The Tobago House of Assembly has never had the kind of structure to do that with the Tobago Regional Health Authority. And that is actually one of the things that we will be building out within the next fiscal year. We will also be building, and I'm glad you've recognized the term, a Department of Social Protection. Because that includes ensuring that all of our social protection staff, all of our social workers, all of our therapeutic counselors, all of our mediators, all of those individuals who we need to help us treat with everything that has been happening over the last 2 years and the years before. We need to put that in a space or developing it in a way that actually makes sense or that actually works, that would allow us to do the kinds of things that the minority leader spoke about. Including, for example, getting additional roving caregivers. There are roving caregivers already there. Getting additional ones on the ground so that we can provide those additional services. The Chief Secretary and Secretary for Finance has, as he indicated, moved over the, the food card fiasco over to the Division of Health, Wellness and Social Protection. And one of the things that, my administrator and I have been speaking quite a bit about, and I've actually started putting the pen to paper, is ensuring that we actually build out the policies for all of these social grants, all of these social programs, so that we will never be in a position again, Madam Presiding Officer, where the Auditor Generals would say to us, well, you're just gain weighting and you don't have it properly structured. And as I have said it to my officers, and I have said it to my administrator on several occasions, I am going to be one of those individuals who ensures that my name and call in no Auditor General report. Because we are taking the time now to actually put the policies in place. We are taking the time now to actually put the systems in place. We are taking the time now to have the necessary staff so that they don't have to be overburdened, so that they don't have to take shortcuts because they have so many clients and do not have the time to get the work done correctly. We are taking the time now to put all of those things in place because Tobago deserves a government that is well structured and that is strategic and that is designed to function for all of Tobagonians and not just the lucky few. I'll take a couple minutes to highlight some of the other projects that the Division of Health, Wellness and Social Protection will be working closely at doing. One of those first ones includes ensuring that we actually have a proper waste management system on the island. What we have now is a system that allows everybody to just throw away everything and it end up in the landfill. It is a landfill that is, and by the way, it is actually one of the only properly functioning landfills in the country. And I congratulate my technical staff who have been working their behinds off to ensure that it is actually a functioning landfill, even though they've been met with a lot of opposition for a lot of things before, and I wouldn't go down that road because I have plenty to talk about. So we are going to ensure that within the division, that we actually have a waste management system that takes into consideration all of the things that we do not need to throw away, that takes into consideration the concept of composting so that we don't have to throw perishable things into the garbage, that takes into consideration what can be recycled, to work closely with the recycling company that is already here to ensure that if it's a plastic, if it's a glass, if it's a paper, you're not throwing that into the landfill. And that way, we can actually extend the life of the landfill, because at this point, the landfill has 2 or 3 years again. 2 or 3 years again. So if we don't do something right now, we will not be able to continue keeping Tobago clean. My Department of Public Health is one that has also been plagued with not necessarily having all of the complement of staff. So we have very limited public health inspectors, and we've been supplementing those public health inspectors who are public servants with contracted positions. Now the thing about it is that what people don't recognize is that unless you actually have the public service position, you do not have the legal authority to go in and do the inspections and do the shutting down and do the things that, or going to court and doing the things that we actually need you to do. So one of the things we are going to be working on is to ensure that we actually have a proper complement of public health inspectors through the public service so that they can actually function and do their jobs. The Office of the County Medical Officer of Health is another one of those entities that we will spend considerable time and considerable resources beefing up. And when I say beefing up, what do I mean? The Office of the CMOH is actually responsible, and you know, for many of us, we had no idea that there was a CMOH or anything like that before COVID. It was only after COVID we realized that these entities were here. They have the oversight responsibility for public health generally.
Member, you have 5 minutes.
So one of the things that we will do is ensure that we beef up the capabilities of the Office of the County Medical Officer of Health. And that would include having a comprehensive data management system. So yes, the digitization that we've been talking about, that will be a part of that process. So that when all of the information, when all of the surveillance data comes in, when all of the data comes in from the Tobago Regional Health Authority, or even from the public health inspectors, we can pull that all in the same space so that we can make informed decisions. We will also finally have our water and food testing labs in Tobago. What does that mean? It means that when we come to your restaurant and so forth and we take the samples, that sample we don't have to then figure out how we are taking it to Trinidad for it to be tested. We can sample it and we can test it right here to let you know that the foods that you are eating, the water that you're consuming is actually safe for consumption. That is what we will be doing. And finally, within the Office of the CMOH, we will be creating what is known as a public health observatory. What does that mean? That would be us looking at everything. Looking at what the diseases are. Looking at whether we have communicable diseases or non-communicable diseases. Pulling all of the data that we get into the management system and have that used to make real, meaningful policy decisions. Now, I am looking directly at the minority leader because when I was at the Division of Health Wellness, well, it was Health and Social Services back then. When I left in 2013 or so, practically all of these things were on the books. They were on the books to be done. Coincidentally, we have gotten to a point. Exactly. Remember he spoke about us being colleagues? So he knows. He knows. Coincidentally, Madam Presiding Officer, we are now in a position to actually get those things done. Finally. Finally, for the people of Tobago. I have spoken quite a bit already about the Department of Social Protection, so I will not go into that a whole lot. But one of the things I want to highlight very quickly is us ensuring that we have ease of access of our services. What does that mean? We are going to get to the point soon where you do not have to come into my division to get services from our social workers and counselors and so forth. But they will actually be out there in the health centers, in the community centers, being a part of the community. So if you are in the east, if you are in the north, if you are in the west, you do not need to come into Scarborough to access our services. Let me also say that part of our ease of access will actually be going to cashless systems. What does that mean? Instead of one man having 400 and something food card in a back pocket, what we will do is actually have a system where each recipient would be able to have it on their phone and swipe, and swipe, and swipe. We'll figure it out. And you see, that is the difference. We will figure it out. We will figure it out. Maybe we need to give them a smartphone We will figure it out. Instead of holding the 400 and something food cards in the back pocket and giving people who don't need them, we will figure it out. Now the thing is, Madam.
Member. Members, the question is that 10 minutes of additional speaking time be given to the member for Belgladden, Glamorgan. All in favor say aye. Aye. Any against? The ayes have it. Member, you have 10 additional speaking time. You may continue your presentation.
Thank you, Madam Presiding Officer. Thank you, Madam Presiding Officer. Let me say one more thing about the Social Protection Department, though. And I am speaking to the hard-working staff at that department. You guys have done an amazing job. You have, when everyone else could have stayed home, when our, accounting unit and HR and all of that could have been on shift and stay home and come half day and so forth. In the middle of the pandemic, you social workers are the ones who stood and you did the work. And I want to thank you. I want to thank you from the bottom of my heart, because I know the kind of work that you've been doing. And my pledge to you is to continue ensuring that you are supported. So, Madam Administrator, when we plan a nice little spa retreat for my social workers, I assume that it would just be signed and approved, because that is the kind of stuff we need for them to work. Let me turn, Madam Presiding Officer, quickly to the Tobago Regional Health Authority, because it is the organization that we give the responsibility of providing health care in Tobago. Let me start by saying one of the things we are going to be doing is really expanding what we consider primary care. What is primary care? That is what you see happening at the health centers. So instead of just coming to the health centers on your clinic day, we want to ensure that the health centers, even though they respond to your sick needs, that they evolve to be wellness centers. What does that mean? You're not just coming when you feel sick, but you're actually coming to ensure that you don't get sick. So when you come, you could learn about healthy eating. When you come, yes, you could do the checkups, bringing back the know your numbers and all of that kind of thing within the community, so that we prevent you from having to come in because you are sick. We tend to spend a lot of money on secondary care, meaning the hospital. But we all recognize that what we need to do, the focus, the aim, needs to be on preventing people from getting to the hospital. Now, if you already have to get to the hospital, then we will be doing the diagnostic testing and so forth to get you well. But the aim is to prevent you from getting to the hospital. And talking about hospitals, let me spend just a couple minutes discussing the Roxborough Health Facility. Now, when I say the Roxborough Health Facility and not the Roxborough Hospital for a very specific reason, I need Tobagonians to recognize that what is at the health facility now is not a hospital yet. And I'm going to take my time because I want you all to know what you are getting into. We do not have the technical capacity. We do not have everything in place just yet to provide inpatient services. What does inpatient services mean? You come in, you get a bed, and you stay. No. Even though your Prime Minister came up and had a big, lavish opening 2 years ago, no. Your Prime Minister, your political leader, we are fixing it. We are fixing it. And that is why I could stand here, Madam Presiding Officer, and let you know why we are where we are now. So there is a situation, Madam Presiding Officer, where I feel like someone just got up a couple years ago and decided that we're going and build a hospital in Roxborough. You know, you just take a VAPS, we get up, we decide today we're building a hospital in Roxborough. We did not take into consideration at that time at all, Madam Presiding Officer, that to get a hospital, you actually need to have different entities within the facility that meets basic minimum standards. And the reason why we do not have a hospital up to this date, Madam Presiding Officer, it is because every single week, when we call the individuals who are supposed to be giving us the license for the pharmacy, the license for the lab, the license for the this, the license for the that, they will watch us and tell us, Madam Presiding Officer, we cannot give you the license yet because that does not meet required minimum standard. That is why we are not there yet. And that is why every time we have a meeting with 𝑘𝐢𝑐𝑜𝑡, for example, because you asked me, every time we have a meeting with 𝑘𝐢𝑐𝑜𝑡, for example, we have to say to them, yes, we told you that we needed this to be built 10 by 10, but in fact it needs to be built 10 by 15. So you know what to go and break down something and start over and put the hood in the proper place and ensure that this, that, and the other is there before we get the stamp of approval that would allow us to run a hospital. So no, unlike those who came before me, I will not be getting up and talking about, we have it. I am going to be honest to the people of Tobago and let them know that yes, we have primary care services. Yes, we have outpatient clinics actually happening. Outpatient clinics are actually happening. So if you need your gynae and you need to do your dialysis and you need to do those things, yes, you can do that right now at the Roxborough Health Facility. But if...
Member, you have 3 minutes.
If you need A&E, meaning accident and emergency services, you can't get that just yet up at Roxborough. If you need something at night or on weekends, you can't get that just yet. And I'm saying to the people, because I know that there are people who've heard that we've opened a hospital and they show up, they're thinking that they will get those services. When we are at the point that we can actually provide those services safe for the people of the East, we shall let you know. You can now come and get A&E services. You can now come and actually sleep in because we are able to do it safely and we are able to do it most efficiently. Let me just say one more thing, Madam Presiding Officer, before wrapping up. That we have actually, and this is a public pronouncement that the Chief Secretary made after we came out of the retreat. We indicated that those individuals who were living month to month within the Tobago Regional Health Authority, those individuals who were getting those 1 month and 3 month contracts, up until now, we were able to give 234 3-year contracts. That is 234 health professionals who know now that we are not just going to cast them aside, who know now that we love and we care for you and that you can have job security. Madam Presiding Officer, I would like to round up my contribution by indicating to all of the staff at the TRHE, to all of the staff at the Division of Health, Wellness and Social Protection, to my 3 administrators thus far since December, to all of my senior staff thus far, that we truly appreciate all of the hard work that you've been putting in, and that the Progressive Democratic Patriots is here to support you and is here to ensure that the organizations that we run are effective and efficient, because you gave us the opportunity on December 6th to fix this and to make Tobago the greatest little island that we are going to be. I thank you, Madam Presiding Officer.
Thank you for your contribution. Members, the House will now be suspended for...
Can you allow me to